introduction, but this is going to be an interview style presentation. So please feel free to ask any questions in the chat, and then Ashley will be monitoring those questions, and kind of as they come in, she'll jump in and ask the questions. But we do have, and so if you guys have a lot of questions, please, I'd love to fill up the time with those questions. And we do have some pre-prepared questions just to keep things moving if you don't have any pressing questions on the top of your mind. So with that being said, we'll go ahead and get started. But Representative Christina Haswood, pronouns she, her, is a public health professional and represents House District 10 in the Kansas State Legislature, which we actually have quite a few members from District 10 or people that work in District 10 in Baldwin City and Lawrence. So I think it'll be a great opportunity for you guys to all connect. But Rep. Haswood is part of the Navajo Nation and has grown up in Lawrence, Kansas her whole life. At age 26, Rep. Haswood is one of the youngest members in the Kansas State Legislature and is one of 3 Indigenous peoples elected into the 2021-2022 legislative session. Recently, Rep. Haswood's first co-sponsored bill, HB 2008, passed the House unanimously. HB 2008 provides that Kansas Attorney General coordinates training with law enforcement to address the missing, murdered Indigenous peoples epidemic. And if you'd like to connect with Representative Haswood outside of this, her contact information was provided in the Eventbrite, so please feel free to reach out. She's very active on Instagram and Facebook at Haswood for Kansas and Twitter, and she does really awesome weekly updates on what's going on in the state. And you can also reach out to her on her website at haswoodforkansas.com. So, Rep. Haswood, thank you so much for joining us. Is there anything you want to add to that introduction?
No, you did a really great job. I appreciate it.
Yeah, awesome. Well, we're so happy to have you here. I just want to remind the audience too, please stay muted, but please feel free to ask any questions in the chat. Ashley will be monitoring that. So, well, first I'd love to get to know you a little bit better for our members that we have here. We have a variety of dietitians and students and dietetic interns. So we kind of span all practice areas right here. So what I want to know is that you're a very young legislator, and I would love to know, what were you doing before you decided to run for office?
Let's see. So that was about a year ago, and I was a grad student in the Master's of Public Health program at the University of Kansas Medical Center, which I think all of y'all are at. Yeah.
Yeah.
Yeah. So with that, I was there wrapping up my MPH program. I also was working at the Center for American Indian Community Health at the Endowment Building, and they graciously paid for my MPH program. And I've been working with them for about 3 or 4 years prior to that, as an undergrad and as well as a grad student through internships. And they are most known for tobacco cessation programming with the 4 tribes here in Kansas, but also in the Kansas City urban Native environment as well as Lawrence urban Native environment. So I was doing that, and I did my capstone project on conducting focus groups at a local Native American university here, trying to figure out with the nicotine electronic delivery systems, so most famously like Juul and Enjoy, and trying to figuring out, is there a connection or correlation with Native Americans here in the Midwest region with their high tobacco usage? Are we seeing that in the younger population in the college areas? That was a fun project. I enjoyed that. And that was pretty much what I was doing before. And, the conversation, I guess, where things overlapped with running for offices, I was just looking for a job. I was going through that, it was my last semester struggle and stress, and where do I want to work? At that time, I was also doing some contract work, working for the National Council of Urban Indian Health. It's a nonprofit organization in Washington, D.C. that partners with the National Indian Health Board. And those 2 industries or organizations work collaboratively to serve health in Native Americans on the reservation as well as Native Americans off the reservations, like myself. And I did an internship with them summer of 2019 in DC, and I guess I did a good job that they wanted to hire me for contract working. That was kind of the direction I was going towards, but then COVID happened. And, with that, it kind of put that direction to a halt. So when I realized that nothing was really going on in person, I started to look locally, and I was looking at working at my local public health department in Douglas County, um, trying to network in that area. But during that time, it was really hard because there was a lot of hiring freezes. I even applied for the governmental program. I forgot what it's called, but I was trying to apply for the Medicaid services in Kansas City. They have like this recent graduate program. I'm forgetting what it's called, but it's like a first step, and then you can go on these other steps of the different levels of government work. I was also where I was, going to apply for medical records. Other options I was looking at too is, definitely wanted to get more into the political space. So I was thinking of just doing a full 180 of not doing public health and just focusing on politics and learning more of that side of the field, because that was really where my interest was. And I always kind of leaned that way. So I was like, might as well just, go fully into that direction and just learn about the political atmosphere of things. Another thing that was on my mind too, none of this ended up working out, was to join the Air Force, because they have a public health department. And when you have your master's degree, I believe you are a higher ranking in the military, and it could also double as, traveling around the world. So that was my last resort. That was, plan A, plan B, plan C, plan D. And that's kind of how I function. I was also doing some volunteering. I was volunteering at the Lawrence High Native American Club. I believe they're the intertribal club. And that's where I really wanted to start giving back to my community and kind of sharing my advice and my experiences to the younger people so they can really see somebody in these positions where we're often not represented.
That's fantastic. Yeah, I love that. I think that's also nice too, because the kind of the scope of dietitians can be really versatile. So even like sharing those experiences on like different things that, especially like our students and interns can look at doing if maybe like direct patient care isn't something that you're interested in doing either. So I love that. So how were you engaged in like policy and advocacy before you ran for office? It sounds like you were kind of in that like political space, but were there any like really key experiences for you that were really like formative?
I think I got interested when I was an undergrad. So I started off at Haskell Nations University, got my associates in science there. I thought I wanted to be a nurse, but then I ended up failing like anatomy. In undergrad, I kept failing anatomy again. So I was like, me like helping people in the medical field, no, no, let's not do that. And in undergrad, I transferred to Arizona State University, and I had this public health like policy and law class there, and we were explained the process of how law health policy works at Arizona State House level. And I was just really intrigued at the process, and we got to actually do like a field trip to the state house there, and I was just really curious because they were talking about CHIP, the Children Health Insurance Program in Arizona, and just hearing how there's people who would be against this was really angering and frustrating. Um, but also learning about my indigenous history and what my ancestors went through and voting rights, that just completely angers me and really gets me fired up. So when I figured that, emotionally, that's what kind of like triggers me, I should probably, work on this and explore this field a little bit more, but also knowing and witnessing there was not a lot of people who look like me and who had the same background as me, was an issue to me. So I wanted to be more present in these types of environments. I carried that interest in grad school, where we did have a policy and law class, and that's where we had the similar. We went to Topeka, and we got to see a committee hearing, and I was really interested in that process, and I had no idea what was going on. But it was just so exciting and interesting to be in that building where law and policy is being made, and that was something that really just, you know, really lit myself up, in comparison to like writing papers and doing the academic journey. I mean, that's the bread and butter of what I was trained on, but I really wanted to see how my research impacted people, or how can I bring my research to a bigger audience. I wanted to do more of a macro impact. And with public health, we work with these smaller communities, and then sometimes maybe it's not sustainable. So I was always interested in how to create change with policy. From a public health background without going to law school, seeing if I could finesse that. I think it's working out so far, but I mean, law school would definitely be useful. Um, but other experiences too is when Representative Dr. Punkwe Victors introduced the Missing and Murdered Indigenous Peoples Bill, the one that we currently co-sponsoring now. I actually saw that bill when she first introduced it at a press release, and I think I skipped class that morning to go to Topeka to actually witness this. I was like, this is probably one of the first things I was like, okay, like I'm done reading about it in the paper. I'm done like reading about it on Facebook. Like I want to be in that room. I want to see it all go down. So, and that's kind of how I learned, like I need to be in that spot and like eat and breathe and live it. So when I went and I saw that, and she asked us to wear red because red is the color of the movement. And she asked us if we want to dress traditionally, we could. So I kind of did a more modern traditional take on my outfit, and then she asked us to stand behind her while she gave the press release, and it was a really powerful moment. But I also saw that there wasn't a lot of Indigenous peoples for a very important bill that is an epidemic across the United States and also Canada. So when I saw that again, like this keep recurs a lot of times when I before I ran for office and did these volunteering works, that I would notice there's not a lot of us in this field and in this environment. So that's kind of what kept me going. And then a couple more I'm just going to add is I did some voter registration volunteering, and I also attended the previous representative here, Representative Eileen Horn, who used to represent District 10. I had big shoes to fill because she was amazing, and she was definitely the champion of food insecurity and food accessibility. I don't know if you guys ever had a chance to talk to her, but I would definitely recommend her. I think she'd be a great resource for you all. But she would have coffee talks on Saturdays, just like now. Like we on a normal year, she would probably have. Or the one I attended, it was at Sean and Sons, which is behind like Freddy's and CC's Pizza. So I attended and just really got to meet her, and I feel really lucky that she represented our values very, very well. So I just started showing up. And, I tell people you don't need an invitation. You just need to find out the day, the time, and you just show up. And even like my presence in the room, I felt that was bringing representation. And oftentimes people who are able to attend these meetings come from a little bit more of a privileged background. And I would consider myself privileged to even be in these spaces too, because I don't have children, and I pretty much just need to take care of myself and pay my apartment rent. So with that, that's kind of how I got into this field.
I think that's such an important point too, because I'm not, most people here on the call are not necessarily like engaged in policy or advocacy at like that policy level. And it can really just be as simple as showing up and being part of those conversations, or just listening to what's going on. Since you brought up the HB 2008, we did have someone ask in the chat if you could tell them a little bit more about that, and what's the purpose of that legislation, and what does that look like?
And showing up is kind of more easier since we're all on Zoom. You just have to like Zoom hop. So HB 2008 is providing recommendation to the Attorney General to have training on missing and murdered Indigenous peoples for our state law enforcement in the statewide. And this is addressed. So this, let me back up. So Kansas hasn't done anything to policy-wise to take a step forward with missing and murdered Indigenous peoples, and this is an epidemic that's happening in the Indigenous communities, where a lot of our loved ones are, gone missing, being violently murdered. Native American women statistically experience a lot higher of violence. Domestic violence is still a big issue, and most, the thing that really I've gotten from this is human trafficking has been one of the things that has been a big contribution to this issue. And also our vulnerable communities, such as the LGBTQ plus community, has been a vulnerable community, our houseless individuals, and a lot of times there's also another acronym called missing and murdered Indigenous women, where Indigenous women are kind of seen as exotic, and we could pass for Asian, Hispanic, we can pass for multiple races that would go high on the human trafficking market. So with this big issue, even here in Kansas, and I believe it's the Kansas City, Missouri side or Kansas side, there was an Indigenous woman who was found rolled up in a carpet. And it was a cold case where nobody knew what happened to her. And I believe Dr. Ponkway Victors is in contact with her mom to help us push this legislation. I'm not too sure if she would be able to testify, or if it's such a sensitive subject still. But something, instances like that happen, and it's happening at higher rates, and most notably in the South Dakota area. But I also tell lawmakers that just because we don't have the statistics, first of all, there's data invisibility. Nobody's tracking this data anyways. But also we can't turn a blind eye that Kansas is in the middle of the country. We have I-35 and I-70, which are, high traffic ways anyways, that we need to pay attention and to have this more training. And the training will also address the issue that Indigenous peoples often get misclassified as another race when law enforcement takes the case. So we want to contribute to fixing the issue of that data invisibility. Oh, you're muted.
Yeah. Luckily my computer is like, stop talking. Yeah. So thank you for sharing that. I do think that's important. And although it's not necessarily like specifically related to dietetics, today we've been talking a lot about social determinants of health and just kind of understanding what other people are going through that might have backgrounds different than our own. And I think that, that insight really just speaks to that there's just so much that can be going on in a family's life that we're unaware of. And when we're trying to focus on health, that, is that the most important thing that day? So as a public health professional, now in the state legislature, what do you perceive as like the top 3 public health issues facing Kansans right now?
I think first is definitely COVID-19, this pandemic. I think, unfortunately, a lot of politics has been played into it, and a lot of misinformation has driven the general public to, not follow public health guidelines, and evidence-based guidelines and common sense guidelines. I think it's the age-old health freedom versus compassion. I think we find in almost every health issue, especially with like viral airborne diseases. Even with my colleagues who choose not to wear a mask, I ask them why, and they believe that their body, they could do what they want with their body. But then again, it's the value of them both thing, they go but anyways, I think that one is a great example of what Kansas is prioritizing, and I believe the governor has done a great job in the beginning of shutting down schools. In public health, we want to protect people, and with this virus, we don't have a game plan for it. To my understanding, in medical textbooks, it's like one paragraph of COVID-19 virus that they study in med school. So no one anticipated this to take down our entire global pandemic system. And I think people often panicked. Biggest thing is probably testing and vaccinations right now, and trying to get people to understand. I get a lot of emails from people across the state that are very frustrated that they are, of the age population, are just below and not getting the vaccine. And we have to kind of remind people that this is a supply issue, and the demand is so high. Things will get better, and trying to explain, why we would want to vaccinate the prison population. Some people are very quick to say that why are we going to give vaccines to people who are not law-abiding citizens? Just trying to explain the public health reasoning in that they can control their environment. I understand where that's coming from. But also, I think a second thing is the accessibility of Medicaid expansion, and especially with rural Kansas. So I sit on the committees of Water, Health and Human Services, and Agriculture committees, which I have a lot of rural representation and colleagues that I work with on a daily basis. And I believe their communities, are being overlooked. And recently in Health and Human Services committees, we had a bill hearing on a rural health model, and trying to address those communities and try to really target them. But also think back into COVID-19, how a lot of our rural health department directors were being subject to attack of this issue. And that really concerned me because I looked in, my own career with public health. It's pretty much just KU Med and K-State, and we're providing MPH degrees that are accredited by the School of Public Health Education. I believe that's the acronym. And, just trying to make sure that we don't scare people away into our field. It could be a tough time, but I think people really need to hear the statistics and resources to make the best decision for themselves. And then I think the third thing would probably be our environment with climate change and climate crisis. So again, I sit on water and agricultural committees, which both go hand in hand. Pretty much every issue, I'm always asking, okay, did we check with the water office? And there's water departments on agriculture side and the water side of Kansas of KDHE and Department of Ag, and really trying to understand those government agencies and department systems, and okay, how does water on the ag side get enforced and what are their duties? We also look at their budgets too, but also on the water side with the Office of Water and under KDHE and how the health implications are that. But also, most recently with the weather and the low temperatures and how our energy plan grid system totally failed. Also hearing my colleagues out of frustration blame sustainable energy resources. Just really trying to maybe take a deep breath and really see the data, and find common ground and move forward with the facts. Oftentimes people's emotions and politics jump at it first, and I really hope that we continue these conversations and invest in these programs for our future and for the betterment of our state.
Representative Haswood, we do have a couple of questions in the chat, but one related to the first issue you were just talking about with COVID. So the comment is, we know that minority groups tend to distrust government interventions due to a long history of discrimination. How do we intervene in these groups in order to promote the vaccine as we roll it out more?
That's a really great question. With any minority group, I highly recommend that you find someone from that community, give them the resources, give them the training, give them the funding, and help them, navigate how we can do this in their community, because each community is different. I guess, for example, if you're trying to target the indigenous community of maybe my district or my community in Lawrence, Kansas, I would, have you find probably our solid group of people who help run things here in Douglas County. So Dr. Frida Gitt from Haskell is a really great contact who always holds community gatherings, community informational sessions. I think if you find those couple individuals and teach them, the process of research or the process of the history and how we can work together and build those relationships. In public health, I think we call it community-based participatory research approach, where we invest into the communities, we build those relationships, and these are not going to form in days. These take often years for a very good relationship and research partnership to go. And the thing that goes to my mind right now is John Hopkins and they on the Navajo Nation, And they also do work with the White Mountain Apache in the Southwest, where they helped a lot with their suicide resources. Johns Hopkins actually has locations on the reservation and hires Navajo and Apache, White Mountain Apache researchers, and they send them, after they're done with their bachelor's degree, they send them to Johns Hopkins in Maryland, and give them the education, but also they have that satellite location where they can go home and fulfill the practices. I think something like that would be really great. But I think I've been on another panel too about vaccine hesitation, and I think really having people understand and having those conversations. Okay, this is what happened to our people in the history context, and how do we move forward all comfortably, knowing that we have these barriers of protection in place for our community. We have these checkpoints, making sure that there's no unethicalness happening or unmorally things are going to happen to our community. But also maybe talking about, okay, if this does happen, what is our next steps? I think having a plan could be a comforting decision, a comforting move, especially in this crazy time where honestly we all probably don't really know what we're doing.
Perfect. So something I'm curious about, I mean, we kind of mentioned it earlier, but our representatives and senators, they all come from a very wide variety of backgrounds. And so when conveying like some of this important information, or maybe everyone just doesn't have that background, like they don't have a public health background or a scientific background or something like that, what is like the best way for us to be able to help educate and provide those facts so that way it's not as triggering or emotional or political?
I've heard my colleagues across the aisle feel, like they'll name like they got an invitation from an organization that's, maybe pretty neutral, but more favors the Democrats or progressive ideologies. And I've overheard a conversation where someone was saying, "Oh, I'm not going to go on that panel because I know they're going to do a gotcha question." I think they feel like, they're going to really get put on the spot, and I think no politician likes that. But I think education, if you can do like a one-on-one meeting with them, and just really hear them out. I think coming from a understanding environment that maybe their areas don't believe the same things that we believe in, but trying to find that common ground of, okay, how, maybe like double masking, or even the simplest thing of wearing a mask. Okay, how can we get that going in that community? That's my strategy is to really have those conversations. And that's all I can think of at the moment, because I mean, it's still difficult that these are the values that people grew up with, and majority of the state legislatures, I think the average age is about 60 or 50. So they're probably not as, open to these things as maybe someone my age or, around my age is. But I think, just trying to build those relationships, and maybe with the organizations too, that, kind of maybe spread that misinformation, but also empowering those who support our priorities in those communities. There's a few people, it's but sometimes they're not as supported, and that's all I can think of, is trying to have those conversations, but respectfully.
That's great.
Representative Haswood. Oh, sorry, Brenda.
Oh, go ahead. Really great advice, and just like further reiterates how creating those relationships with your legislator are really important for us. You can go ahead, Ashley.
Another question for you, and this is kind of in line with communication and then in terms of like making change. But one comment was speaking on how the USDA foods, some that are given to Indigenous communities, are not always appropriate, such as like powdered milk, knowing that many Indigenous people are lactose intolerant. So what are some ways to have an impact on how to start to change what foods are offered, and how to start that communication, and so forth?
Are you talking about the commodities?
I believe so. Yeah.
Ah, nice. My grandparents still get these foods. They um they don't eat the pasta because that's not what they grew up on. So sometimes when we're there, we'll take the pasta home with us. But to my understanding, it improved a little bit because now they offer fresh produce. And I'm not too sure how recently that change was because I remember, because I grew up, most of my family's on the reservation, so we do this back and forth road trip a couple times a year, and I remember them getting commodity foods. I think I would have to probably see in the organizational chart, but I think a great way would be to have someone who has this knowledge or an indigenous person at the FDA at this level who's making these types of decisions, advocating, for these nutritional contexts. Because I'm not too sure, I'm not familiarized with the entire like food commodity program, and I'm not too sure if everybody gets the same food in across the country because we can also look at indigenous diets and how like maybe the southwestern diet is way different than the commodities that the indigenous peoples get here in Kansas or here in the Dakotas, in Michigan and Idaho. That's where my mind is going with that.
Perfect. I want to jump back to those top three public health issues facing Kansans. So COVID, Medicaid, and especially in rural areas, and then also climate change. And what role do you see dietitians playing in these issues?
I think education is definitely the biggest part, but also being having a presence in the community, um, and debunking a lot of myths. And the things that my mind goes to is I did a little bit of research on dietitians and how they debunk myths, but things like fat free, really understanding, what does it mean in the grocery store and is this healthy for you and is this good for your body? Like I think another thing that went to my mind with agriculture committee, and this is an issue in ag, is the impossible beef and beef industries. They're kind of button heads right now. I think we're gonna have a hearing on this pretty soon. But I assume this is not an issue in the rural area, but maybe in the more urban area where the train of things are going is more plant based. I think people when they want to be having these diets they don't understand that maybe your body needs a supplement of nutrition. I think one of the biggest things that we're still fighting is obesity, um, just period on the ground level of everything, even myself. And that relationship with food, I think is something that dietitians can play a big role in. Another thing that my public health mind is going to is cooking classes. I did an internship at Native Health when I was an undergrad in Phoenix, which is an urban Indian health center, and they did cooking classes, and I was surprised to see that people don't even know how to chop vegetables and fruits. Something basic like you tell people to eat healthy, but they don't even know how to chop foods. Like we have to really remind ourselves and humble ourselves that sometimes people did not grow up cooking fresh produce and vegetables. Maybe they grew up with box mac and cheese, pasta sauce in a jar and pasta to just boil in water. Taking those basic steps back and help educating people in that way. Social media too. Um, I'm a big TikToker and going into these spaces where the younger people are and just really showing your presence there and showing the facts, but also doing it in a, um, I guess, generational, cultural, tailor way would be great as well. I know in the indigenous population, there's an indigenous researcher named Devin Montesua. She's from Baldwin City. I'm mispronouncing her last name, but I believe she works at KU2, and she done a couple textbooks, I believe, on indigenous diets. I think she'd be a great resource to tap into if you guys ever have any questions about the indigenous diet and how to get into indigenous communities with that. Um, I think visiting classrooms too with the younger kids and high schools, I think just the same thing, you know, just showing up everywhere and um, really offering that dietitians are a vital part of our healthcare system. And I think when I'm thinking back in my own education, our health journey, when in when in my health journey have I ever come in contact with a dietitian? It came from me asking, how can I better my nutrition? How can I lose weight in a healthy way? How can I build a healthier relationship with food? Because for me, I think one of the biggest realizations is when I was at KU Med, I believe KU dietitians had some type of research program for those people, I think staff members and students who wanted to lose weight. Um, and I went into the health center there at KU Med, and I met with a dietitian, and she sat me down and said, "Okay, you know, these are the healthy foods for you, and let's talk about your diet." But also a great aspect of it was counseling to help with food relation. And I was kind of offended at first. I was like, "Why am I getting put in counseling for food?" And then I thought about it, and I talked with the counselor about it, and you know, I consider myself an emotional eater, a stress eater, and drinking too much coffee. So even putting that normalizing it in my health journey, something that kind of is stigmatizing, counseling and therapy and all that, I think was really beneficial for me. And I tell people that all the time. I was like, you know, you can actually go to the counselor to talk about your relationship with food. That's something I never knew.
Representative Haswood, we have another question going a different direction. This one is about Medicaid. Can you speak to what is happening with Medicaid expansion in Kansas and what we can do to help advocate for its expansion?
So, to be blunt, Medicaid expansion is not looking great. And this is, you know, the to my understanding, where it is right now, the governor put out a statement, I believe, last week or 2 weeks ago, where she is adding, I guess, kind of a leverage of medical cannabis with it as well. And I think this helps aid the concern of, um, you know, getting.
Representative Haswood, I think you've cut out. Done. Oops, sorry everyone, just give us 1 second. We'll see if we can get her back.
Well,
Finishing, well, I am not super well versed on Medicaid expansion in Kansas, but oh, is Christina?
am I back?
Yes, you are. Okay, sorry.
Okay.
We'll go back to that. Yeah, sorry. I think we missed like most of that. So we got to adding a provision for like medical cannabis.
Oh, okay. Sorry, my internet. So, you know, I asked my leadership too because it's a very complicated process. It's a big piece of policy and legislation that even the governor is putting her say in it. So what I got from my leadership is that, you know, it's even if we introduce it, it's gonna go nowhere. Um, so I think they're trying to strategize on what's the best chance for Medicaid expansion. I think everyone is doing a great job of, you know, emailing their state representatives and senators. I would advise you to email the ones that represent you because a lot of representatives and senators don't even look at emails that, you know, you don't put your email address that you're in their district. I caution those who use like that copy and paste from organizations. I think those are a great way to get comfortable with the routine. But I hear from a lot of my colleagues that they rather hear like straight from you, like, and also include the bill number if there is, and if there isn't, calling their office too. I know some people will call my office multiple times. My office assistant's like, please call them back. They want to talk to you. um, but yeah, those are probably my recommendations on getting in contact with your representative or senator. And if you're having no luck with them, you can always contact me, and I can find them in the state house and say, hey, like, your constituent contacted me because they were having issues. I'll be really nice about it and be like, they were having issues of contacting you, so I thought I could, deliver the message. This is the politician side of me. But I'm more than happy to, if you want me to print it out and hand deliver it to their face, I'm more than happy to be your advocate in that sense. I think providing testimony too is another great way. And if you have any issues or concerns with that, I can definitely walk you through the process, like submitting your testimony 24 hours in advance, who to submit it to. I could definitely help anybody who's interested in exercising their right in that way. Anybody can send a testimony. I think those are just a couple ways that you can definitely have your voice heard at the state house.
Perfect. I think that's excellent. And yeah, we're actually going to submit testimony on Monday. So yeah. And I do think that, yeah, as our other members, feel free to engage in that. If you are representing KSAND, or if you're going to mention KSAND, it is really kind of important that you align with our talking points on that. But if you're representing yourself to submit testimony, then you can say whatever that you would like to say. So just keep that in mind too, as like our members, if we attach our KSAND name to it, it does need to align. But as a constituent, you can share whatever perspectives that you have. So, and thanks for offering to help with that, because I know that's like a really intimidating process for a lot of people, and just like engaging in most of that. So awesome. I kind of want to go back to being one of 3 Native American members in the Kansas legislature. And what impact do you feel like this has on policy and having some of this diversity?
I think bringing this voice as, I think it makes people uncomfortable. And the thing that's coming to my head is when I sit on agriculture committee, I asked my chairman, hey, we hear like Kansas commodities, corn and soybean and, beef, they all did great during COVID. But we heard about the meat packaging workers. They weren't doing too great. And I was like, I'm coming from a public health background. On Health and Human Services Committee, we're always talking about the workforce. We're always talking about the nurses and the physicians and the dietitians. We're always talking about the workforce. How come we're never talking about the workforce in agriculture? And I was like, specifically, I believe this industry is represented by the Hispanic population. And, I know that might be a little political, but, that's a conversation I had one-on-one with my chairman. And he was kind of fumbling a little bit. I think just bringing those types of conversations to people's face. I haven't said it in committee just yet, because I don't want to, throw my chairman, for a head spin on that. But I just kind of brought it to his attention that, I'm going to ask these questions in committee. I don't mean to, put you on the spot or make you look bad, but these are just my concerns and questions. And I bring these questions to like the Kansas Livestock Association. I brought it to the Department of Agriculture as well. Like, hey, why aren't we talking about the workers who, do these intense labor jobs to put food on our table? I think accountability too, of asking these questions, and it might be a little bit, I don't know, I think it has more of an urgency and emphasis coming from a person of color asking about people of color. Maybe it has that more impact and that more punch. I also think that we are also bringing the conversation of race and inequality, and really explain to people the difference between equity and equality, and where do we want these words of power and conversation to come into which situations. I think we're bringing a strong voice. We're bringing Indigenous topics and issues that, maybe we would have to rely on our representative to bring up. But, for me, I had two Indigenous bills that I co-sponsored, HB 2008, the Missing and Indigenous Peoples, and then the other one was changing Columbus Day to Indigenous Peoples Day, and having that conversation with people on why changing a day is bringing positivity to the Indigenous peoples, because that conversation can be a little tricky, as well as the conversation of Native American people as mascots. Same thing, just really trying to explain people and with evidence-based why, Columbus Day and, us Indigenous kids go back home and we learn about the real, I guess the real history of this invasion and what it did to our people and how it pretty much had this ripple effect, contributing to, historical trauma and all that. I think it's still a challenge to explain these concepts to people who probably have not heard of these concepts before, or, come back at you saying, well, this isn't important. I think these are things I'm still working on and I'm still learning as well. I think it's only been my 8th or 9th week in the Kansas legislature, so I'm learning a lot. And if anyone has any other tips, please feel free to message me.
Yeah, I think that's really important. And these conversations, they take a long time to build, like, especially because they're really complex topics, right? And like creating that, like, to someone who's never even heard of historical trauma and like, wait, why reliving that not only every day of your life, but like every single year, like, like how that's really damaging to an entire like population of people. And that does like take time. But how do you feel that your Native heritage has like kind of informed some of these like perspectives on health?
So it's interesting because when I've always been in this health field for my higher education, and learning my culture as growing up and then coming to college and having a textbook tell me that, the term holistic health, I was like, oh, that's something like we've always been doing. Like, I guess this is the textbook term and this is direction that everybody are going to. Not my tribe in particular, but other tribes have this thing called the medicine wheel, and it's like into this 4 pizza pie. And it's pretty much the same thing, I think, in our textbooks of the holistic health of physical health, mental health, environmental health, and spiritual health. Um, so when I saw that, I was like, okay, I think I'm in the right direction. Then what really helped me is I did an internship at Diné College, which means Navajo. Navajo in our language is Diné. I went to my reservation into our college I got taught the public health model and epidemiology through our Navajo logistical models and cultural practices. And that really helped me build this connection of Indigenous public health and really helping, drawing connections to this and helping other Indigenous populations. Um, I think it really helped me put the emphasis on mental health and spiritual health. And I look back in my campaign where maybe some days were a little bit rocky. Maybe, I was getting slandered a bit on social media, and it was, not putting me in the best of mood. And one of the things my mother would advise me is to pray. And that's something that we do. And I think a lot of people in their religious and spiritual and cultural beliefs do. In my culture in particular, we a traditional practice is to get up before the sun, just a little bit before the sun rises, to go run, and then you pray to the sun to the east for a new day, and you pray for your blessings. You pray for strength. We also do like cedar burning as well, and just something that I've done since I was a child, and that we do here in Kansas, and we do on the reservation, and we do in our ceremonies. Just really helped put my mindset and mental health in a great atmosphere. And I think that also helps with my positive, nonchalant attitude sometimes. Like, oh, okay, we'll get them next time. Sometimes my colleagues might be a little angry. I'm just like, well, that's what happens, and we'll just come back stronger. We need to go back into our communities and help empower them to help us with these issues. I think that really helps my mental health, but also in my career journey and in policy making as well.
Representative Haswood, we have a couple of questions just before we start wrapping up. One was, someone wanted clarification on something you said in regards to the medical expansion. Does the bundling of medical marijuana and Medicaid expansion help or hurt the chances of it moving forward?
I think it helps slightly because I think the conversation of medical marijuana and cannabis on the other side of the aisle is there, but we believe that it's not a big enough, strong enough leverage. And the way I kind of look at it is leverage with a plastic fork. Like it's there, but it's not strong. Um, and that's kind of our perspective now as why we don't have enough of a bargaining tool to tell the other side that we need Medicaid expansion. And I believe the conversation now is to find people to replace their seats so we can get the votes to pass Medicaid expansion. I guess last year, they had to do a thing called gut and go with the APRN bill. And the thing at the end of the day is that we don't have enough votes in the House or in the Senate. And if, it could easily be override in either chambers too. So I think finding those, moderate Republicans who, who you feel like can be convinced would probably be the best way to put your energy on and help them understand like how would this help their community. I've also heard with my colleagues too, because one time I asked one of my Republican colleagues, I was like, okay, I'm forgetting why you guys don't want Medicaid expansion. Like, hasn't the pandemic shown you all enough? And we're talking about rural health here, and they're really concerned about the economic finances of our state. And they say, well, you don't have a concrete detailed financial plan on where this money is going to come from. So I think, their mindset is all on economics too, and and I feel, as a public health person, we don't learn anything about economics. So I find this conversation a little bit hard for me to throw my jabs in. So that's where I really rely on my colleagues who do have that tax background, that business background, that economic background. Okay, I think that's what I'm learning too right now is how do I frame my public health knowledge with something that I'm not comfortable and familiar with, like taxes and economics, and also like spit it out into something that I could be more comfortable in using and help with these points that they tell me that they can't support Medicaid expansion just yet.
Awesome. And I think we have about 5 more minutes for questions. So I'll let Ashley finish asking some of the questions in the chat and then we'll wrap it up.
Sorry, that was my child. Another question we have, let's see, what do you recommend any people to follow online, whether it's Instagram, podcasts, etc., for different perspectives, like on topics such as mascots, Columbus, or just like a general BIPOC point of view?
That's a good question. So All My Relations is an Indigenous podcast. It's with 2 Indigenous women. One of them is Dr. Adrienne. I'm forgetting her last name, but she's from the academic standpoint. That's one of my favorite podcasts to listen to. There's a lot of great other Indigenous podcasts from like students. I just did one last week. And I'm forgetting their name. I'm sorry, I didn't write. I didn't anticipate this question to write it down. But I have my newsletter too. That you guys can. We try to keep y'all in the loop on what's going on in the state legislature and what to anticipate. I think if you fall down the rabbit hole on social media of like Native Instagram, Indigenous Instagram, you'll find a lot of great podcasts and Instagrams. Native Woman Running on Instagram is another great organization that I have been happy to be featured in a couple times. And they focus a lot on missing murdered Indigenous peoples epidemic and running to bring awareness. Yeah, I think those are a couple that just come to mind.
Thank you. Someone else wrote kind of a double question. As a member of the House Health and Human Services Committee, would it be helpful to you if we communicated any concerns with the bill before the committee? But also, is it also helpful to hear from members of the community, even though not a constituent?
Yeah, so I think this depends on each legislature. As I previously mentioned, some of them are really strict on if you don't put your address and they see that you're not in their district, like they will pay no mind to you. So for me, when I like to get information before the bill hearing, just because a lot of times just trying to juggle like 50 things at once. So it's really helpful for me to get an email about, okay, you have a bill hearing coming up in your Health and Human Services Committee. This is the background of it, and this is why it would be great for Kansas, or this is why it would be bad for Kansas. If you could find people if you live in my district, that's something that would be really great too, just to hear how it would impact District 10, good and bad. Let's see what else. And I think anytime, because I have a special folder for people who will comment on bills in my committees, because I always want to hear both sides of the perspective. And in committee, when people testify, there's like a proponent for people who want the bill and opponents who don't want the bill. There's also a neutral side where, there's an organization who just wants to spit out the facts and let you decide. So those are great. And then if you want to schedule a meeting with me, those are probably the great things for me, is like a 15-minute, 30-minute meeting where you tell me, what you want to tell me. That really helps me as well.
Awesome. Thank you so much for all of that insight. I think we're going to go ahead and wrap it up, but I want to, if any closing thoughts that you want to share with our members today?
Thank you so much for, inviting me here today. It's been a great conversation. I know we didn't get through all the questions, but if anybody has any questions, how to get more politically active as a health professional, or, even reading a bill, or, if a bill is really confusing, I can ask the reviser on your behalf to put it in more in layman's terms, because it's probably something I should be aware of as well. I'm more than happy to answer any more of your questions, and thank you so much for your time today.
Yeah, thanks for taking the time off of your Saturday to join us. And you are more than welcome to stay for our upcoming cooking class. And I would recommend to everyone to follow Representative Haswood on all like the social media platforms, TikTok, Instagram. Her weekly updates on what's going on in the legislature are super helpful, especially if you're like, if it seems like a really big task. So I would definitely recommend that. And we're gonna go ahead and take a 10-minute break. We're gonna start at 11:15 for our cooking class, and we're gonna have Chef Rachel, and we're gonna make some souvlaki. So I'll see you all in about 10 minutes.